Hey everyone, Coach Jordan here, bringing you our virtual healthy break, understanding colon cancer. I'm sure this is something that we have all heard about and not something that's always fun and exciting to talk about, but colon cancer is one of the deadliest cancers we have to face, and it's very important to understand your risks, understand what colon cancer is, and really understand what you can do to prevent it. So, we're going to cover a few topics today. How common is colon cancer? What even is colon cancer? What are the risk factors? The signs and symptoms you can look out for? What kind of test options do you have? And then, most importantly, what can you do to prevent colon cancer? So, how common is colon cancer? It's the third most common cancer diagnosed in men and women, and there's estimated to be about 53,000 deaths in 2020 due to colon cancer. It is important to note that the death and incident rates are increasing in men and women between the age of 20 and 49. Typically, doctors don't start testing for colon cancer until age 50, but there are some tests that we'll talk about later that you can be doing in this time period to stay on top of things. So it's important to understand what the colon is and understand your digestive system. So your digestive system works in this way. You chew food in your mouth, you swallow it, it goes to the esophagus, that goes into your stomach, then into your small intestine, your large intestine, and then your anus. So your colon is the first part of the large intestine and is about 5 feet long. So now that we know what the colon is and where it is in the digestive system, what is colon cancer? So cancer forms inside polyps that occur in the colon. It's important to remember not all polyps are cancerous, but all polyps could become cancerous. It really just depends on what's happening inside those clumps of cells that form the polyps. Polyps are small and they typically don't have any symptoms associated with it, and that's why having these preventative exams done are key. You really don't know what's going on in there until you get in there and look at it. So it's important to realize that anything that increases your chance of having some type of issue, whether it's colon cancer, diabetes, or hypertension, is considered a risk factor. But having a risk factor doesn't necessarily mean that you're going to get cancer. And vice versa, not having a risk factor doesn't necessarily mean you'll never get cancer. It's just something to keep you thinking and talking with your doctor about the things that might predispose you to cancer. Some common risk factors with colon cancer is a family history and a first degree relative. So, that being your mom, your dad, your brother or sister, someone in your immediate family. Any GI issues or diseases that you might have or have had in the past. Smoking is definitely a risk factor for colon cancer and really any other type of cancers. Race is also a risk factor. Being African American increases your risks of getting it. Obesity is also a risk factor. And a diet high in red meat, processed food, a diet that's low in fiber, those can all play a role into your risk factors for colon cancer. So most early colorectal cancers produce no symptoms. Again, those polyps, you might not even know that you have them at all. You might not see any signs. And that's why that screening is so important. But there are a couple of things that tend to happen in people who do have colon cancer that can be a red flag. So any kind of blood in your stool, bright red or very dark blood, any type of blood in your stool, call your doctor immediately. Frequent gas pains, bloating, fullness, cramps, and this is frequently meaning almost every day. and at a very high pain level. Um, a lot of times it's a hardness in the lower part of your stomach where you feel bloated. That's definitely something that you want to follow up with your doctor about. And then weight loss for no known reason. So, not that you've changed anything in your diet drastically, not that you've been exercising harder, but all of a sudden you lose 10 or 15 pounds very quickly. That is definitely a red flag and something to call your doctor about. So, just a note, a lot of these tests to prevent colon cancer or screening tests are covered under your insurance as a preventative exam. There are some requirements by age, by necessity, and some other things that the insurance would want to see, but that's definitely something you can talk with your doctor about when figuring out which of these tests will work for you. So screening should begin at the age of 50. You may be required to test earlier than 50 if you have some of those risk factors we just talked about. So you or a close first degree relative, brother, sister, mom, dad, have had colorectal polyps or colorectal cancer. If you have an inflammatory bowel disease, or if you have specific genetic syndromes that might predispose you to colon cancer, your doctor may want to start testing you earlier. So let's talk a little bit about testing for colon cancer. There are all different types of testing. We've come a really long way in the past decade with testing for colon cancer and trying to get a head start and a preventative start on beating colon cancer. So the first test would be your annual physical. This is when the doctor is usually pressing on different parts of your stomach and your sides. They're looking for lumps or anything unusual. Also, a really important reason to get that annual physical every year. This gives your doctor an opportunity to look for signs of abnormality or look for something that doesn't seem right. Then you have the digital rectal exam. That's just your exam of the rectum where your doctor would insert a lubricated finger into the rectum to feel around for lumps or anything else unusual. Not the most fun test we have to go through as adults, but it is very effective in finding some abnormalities, especially in those under 50. This is one of those tests that you can start doing, as young as age 20. The next is the fecal occult blood test. It is a test to check for blood in the stool and can be seen with a microscope. This is another one of those that is also helpful in people under 50, something your doctor might want to do just to check and stay on top of things. And it's typically recommended to repeat every year. Some advantages to FOBT: no yucky drinks to cleanse the colon, no special diet you have to do the day before or the night before, like a colonoscopy might be. Your samples can be collected at home. However, it's typically done in a doctor's office so that they can put that sample onto the slide immediately and check it under the microscope. It does have a low cost and there's no sedation needed, so you don't have to be put to sleep for it. Some disadvantages: it doesn't detect some polyps or cancers. It really just depends on where it is. There are some false positive test results that can always occur. And then with any of these tests, you may have follow-up procedures needed if you have some abnormal results in the sample. You probably have all seen the commercial for Cologuard, our friendly little white box that walks around the house and forgets his glasses. And this is a really cool new thing that we in the science community have found is you can do this at home. This is something that makes it easier, it gives people access, and it has really helped the preventative rate of people getting these exams. It's something that you can do at home. You don't have to take time off work to go and do it. So it's a really cool new invention that we have. And what Cologuard does is it tests for DNA. It tests for 9 specific biomarkers in your genes that have been found in colorectal cancer. Typically, you repeat it every 1 to 3 years. And what I've heard from most doctors is this is something that they might have their patients do in between colonoscopy time periods just to stay on top of things. These are typically covered by insurance as well, usually at 100%, depending on your insurance, and definitely something that you can talk with your insurance company and with the doctor about. But the maximum out of pocket a person would spend would be about $650 for this. So advantages again, no cleansing, no yucky drinks, no dietary restrictions, and you can do it at home without being put to sleep or taking time off work. Some disadvantages is the cost may be higher than the FOBT. It really just depends again on your insurance and how your doctor's office bills and files claims to the insurance. The test sensitivity for polyps is low. Again, it's not a camera looking inside the colon. We're just looking at the DNA of the fecal matter. And again, additional procedures may be needed if the test shows some abnormal results. So getting into a little bit more intensive testing, a sigmoidoscopy is a procedure that looks inside the rectum and the lower colon for polyps and other abnormal areas. So this has a camera attached to the end of it. It also may have a tool that can remove small polyps or collect tissue samples for biopsy and testing. It's typically recommended every 5 years for those who have average risk and negative test results. And the average cost of this is about $150 to $300, again, depending on your insurance. Advantages to the sigmoidoscopy: no sedation, discomfort is minimal, complications are very rare for this, and it can remove those polyps or perform a biopsy during the test if needed. Some disadvantages: you may have to do a little bit of colon cleansing, definitely less extensive than some of the other tests, but might have to take some fiber before the test. You have a very small risk of bleeding or tearing of the colon tissue. And then some of the growths in the upper colon may be missed because, again, the sigmoidoscopy is looking at the lower portion of the colon. And the colonoscopy, something you've heard very commonly, often the first test referred to when talking about colon cancer. So this procedure is a camera that is inserted inside the rectum and the whole colon. So it's more extensive than the sigmoidoscopy. We're looking at the whole thing and checking for any polyps or any abnormal areas. It also has the tool that can take biopsies and remove small polyps if needed. But something important to remember about this is studies suggest that colonoscopies, having those, reduces deaths from colorectal cancer by up to 70%. That's a lot of deaths that have been saved and can still be saved by having this colonoscopy done regularly. These are typically covered under the Affordable Care Act at 100%. There are some guidelines with that, again, but colonoscopy is one of those that is covered at 100% by your insurance as a preventative exam. And it's typically done every 10 years for normal results. May vary depending on if there's any polyps found or if your doctor has identified any other risk factors. He might want to do that every 5 years instead. So advantages to the colonoscopy, it is the most accurate testing that we have for colon cancer. It allows the doctor to view the whole rectum and the entire colon. And again, you can perform a biopsy or remove those polyps during the test if needed. Some disadvantages, they may not detect really small polyps or polyps that aren't developed yet, so therefore it might not detect a cancerous polyp if it's very small. You do have to drink all those yucky drinks and thoroughly cleanse your colon. There's a diet that you have to do a few days before and after, so that can get a little messy. And some form of sedation is always used, typically done as an outpatient procedure and doesn't take longer than a few hours to be in and out, but you do have to be put to sleep, take time off work, and have somebody who can drive you to and from the outpatient facility. A new procedure that's starting to gain a little traction is a virtual colonoscopy. It's also called a CT colonography. So what that is basically an X-ray pictures or CT taken of your colon and digestive system. So doctors are able to look at these X-ray pictures and piece together and look for any polyps or abnormalities there. It's recommended to repeat about every 5 years. So there are advantages and disadvantages of the virtual colonoscopy. Of course, it is the least invasive of the test, and you don't have to be put to sleep or under sedation to have it done. But again, it is a really new procedure, and the accuracy is not yet known. Once we've had this for a couple of years, we'll really be able to see what kind of accuracy doing the virtual colonoscopy can give us. But for now, we're just not sure. It's also not covered under most insurances because it is new. So if that is something that your doctor suggests to you, you definitely want to talk with him and talk with your insurance company to see how it would be covered and what would be your out-of-pocket expense. Another disadvantage is it does require some cleansing, and that is always a not fun part of having those colonoscopies done, whether it's traditional or virtual. So what can we do? How can we protect ourselves and give ourselves the best chance of preventing colon cancer? Get screened. I cannot emphasize this enough. I know it is not fun. It is not something that you're looking forward to, but it is so important. Screenings give you a 70% chance lower risk of death just by going and getting screened and talking with your doctor. Pay attention to your body. Watch for any unusual changes, any unusual symptoms, different things that are happening with no explained reason. And contact your doctor to set up an appointment. Talk to him at your annual physical. Give him a call or give the nurse a call and see if you need to be doing some kind of the preventative screenings that we've talked about this year. There's also things that we can do just in our life to prevent colon cancer. Definitely dietary changes. So eating a lot of fiber, things like the fiber chews or even having benefiber in the morning. Beans, lentils, whole grains, oatmeal. Those things are great high in fiber foods that you can eat daily and make sure that you're getting enough fiber in your system. Drink plenty of water, a ton of water. Water is so good for our body, but especially for our digestive system and keeping everything moving like it should. Cut back on the red meat and have just very small, moderate, leaner red meat portions when you do have it. Focus more on chicken, fish, turkey, those leaner meats with less fat and less processed meats. Maintain your weight. Try to keep a good weight for your body and how you feel is the best weight for you. And stay active. Cardio. Cardio is key. I almost want to make that our motto is just cardio is key of life. So anytime you can get out and work in the yard, go for a 15-minute walk, even doing housework like sweeping and mopping the floors. Those things are great small activities that you can do to stay active. So here is the moment you've all been waiting for, our healthy credit question. Name one colon cancer preventative exam we covered in this healthy break. You can text or email your answer to me for a healthy credit. Here are some resources for you in case you want some more information on colon cancer. And as always, I can be a resource to you as well. So please don't hesitate to reach out to me with any questions you may have. Thank you all for joining, and I hope to see you in person very soon. Bye.